Hey everyone! Today's part 2 of my interview with veterinary behaviorist Dr. Lisa Radosta. Enjoy! In terms of behavior, how do you think that the ideology has developed or evolved related to behavior in the last, say, 10 years? Have you seen a lot of changes, especially where this is, again, this is your lens, this is where you work?
Yeah. Yeah. So I can compare, I'm going to go back to like when I was at my residency, 2003 to 2006, I was in Philadelphia. I think at that time, behavior was weird. What is it? We don't know what it is. It's not a hard science, right? It's just this thing that these like 50 people in the world are, specialists in and whatever. And now through education of veterinarians, through Fear Free, which is probably what was that, 2015, 16, probably Marty started Fear Free. So Fear Free. And then also COVID really helped us, not because the dogs were severely affected or the cats, but more that people understood that emotional well-being is a big deal. It's not a little thing. And also, hopefully through my efforts and the efforts of people that are in positions like me to put science out there. I don't create the science, I interpret and put it out in a practical, digestible way. What I see now, at least from my demographic here in Southeast Florida, is early referral. We see puppies all the time. We see young animals. We see animals who I think would have been euthanized easily 15 years ago. So the awareness is there. I think also I get less pushback from primary care veterinarians. If I suggest something, their minds are open. I just had a lovely phone call with a primary care veterinarian not that long ago, just 3 or 4 days ago, where I said, I've seen your patient. We need to get medical care. This is a IM sedation. IM, for people that aren't medical, is intramuscular, right? It's an injection with a needle. So that's where the path I'm going down with this dog now. And then in the long term, we're going to work on cooperative care and blah, blah, blah. But right now, the dog needs care. So I need to know from you what sedation you're going to give. I'm going to work backwards and do my oral meds and my handling based on the sedation, because the veterinarian in charge of that sedation is in charge of the life or death of that patient. So I don't start with the ivory tower. I'm going to give the pet these drugs, figure it out, primary care. No, it's more like, you're responsible for the life of that patient when they go under anesthesia. What do you like? Let me figure out how to work around your system. So not only did that veterinarian talk to me about it, but they also said, which I warmed my heart at the end of a really long day that was frustrating. They said, thank you. I really appreciate you being there.
Yeah.
Really, that makes it worthwhile. That not only is it like, because that conversation 15 years ago, and I remember these conversations would have been, I remember one cat vet, he always cracked me up. He was older and he would say, I don't know what you do, Dr. Radosta, but I'm glad you're there. So that kind of attitude, which I appreciated then, has morphed to, I get you. I understand why you're there. I appreciate why you're there. So now it's our job as veterinary behaviorists to ride the wave and not break the wave, because, you can be glass half full or glass half empty. In this particular case, I'm glass half full. Let's ride the wave. Let's educate every vet and every pet parent and every dog training professional and every groomer while their interest is piqued,
Oh, those are great points. I love that you mentioned that you're seeing more puppies or younger animals, because a lot of times I'll hear from folks, oh, I'll say, have you spoken to your vet? Did they recommend any medication? And they say, oh no, my dog is a puppy still. They're very young. And I say, oh, okay, so have you spoken to your vet? We want to intervene sooner. We don't want to let stress, fear, anxiety just build and build. And like you said, after 3 months, and this could be in the continuum, even if we're just talking about an animal going through different socialization periods of their life. If we wait till they're a year or 2 years, we may have a full-blown, really difficult problem behavior and entrenched, which is much more difficult to change. And so that's really good news to hear that positive out of COVID. One of the things that I say is that before COVID, I used to say I work via a platform called Zoom, and nobody exactly knew what it was. So that eliminated me needing to say that. Now everybody is more amenable. There are so many options to talk to people like us today via online options. And on that note too, we're talking about the differences and seeing patients early and other clinicians recognizing what you do and incorporating, your work with theirs. What types of things can pet parents expect, particularly in your office, that might be different from previous experiences that they would have had in other veterinarian offices, whereby the focus on cooperative care might not be as readily available or as understood?
Yeah, I think some of the differences they'll see, besides the fact that it's a veterinary behavior appointment, so it looks different than a GP appointment, right? But one of the things they'll see is I try to teach my doctors, because I train a lot of residents, and so I try to teach them to do a touchless exam, which veterinarians are not trained to do. And I just gave a lecture for PPG, Pet Professional Guild, and one of the things I talked about in that lecture, so that's for dog training professionals who I feel are on the front lines with a lot of pet parents and dogs, is how to do a touchless exam. Nail wear should be even on all four paws. I'm looking at the dog. I'm looking at the cat. How are they moving? Right? I'm looking at if their anatomy looks normal. I have Rottweiler came in with hyperextended hocks. That's not normal anatomy. Okay. Is the muscle symmetrical on both sides? So for people that aren't medical, the same on both sides. Your pet should look the same on both sides. Period. Okay. If they're not, there's a reason why they don't. Chronic diarrhea, that's not normal. Okay. The number of dogs who have soft bowel movements on a daily basis is astronomical. That's not normal. Okay. So we're looking for the touchless physical exam. That's number one. Number two, we're going to call it if the pet is too stressed, which at some vet practices they won't. A lot they will, but some they won't. Okay. Number three, if we have to call it, you're going to go home with drugs. Period. End of story. Right? You can decline, of course, but we're going to talk to you about them. And then number four, we are going to do things differently with food. And sometimes we're going to do stuff that a typical vet will not be able to do because we use food. There's innumerable times, I can't count the number of times a pet parent has said to me, "Did you draw the blood yet?" And I'm like, "We're done." Right? Because there's a bowl of food shoved in the dog's face and he's eating the entire time. Yesterday, I saw a dog who has to be sedated at the veterinarian's office. I said, "I just want to listen to your dog's heart. No one's done that. I'm worried." I have this little device. It's called an Echo. It's a human device and it has EKG leads on it, but it's all very flat, right? And if you put it, it's not made for dogs, but if you put it in the right place, I can get EKG, I can get murmur, everything coming through my earbuds, and I don't have to be next to the animal. So it turned out that I was not good at giving instruction to the pet parent about where to put it. And so she said, "Do you just want to try?" And I said, I would love to actually be the one to put it on your dog because I know I would get it fast. If I did that, I'd get the heart rate, I'd hear the murmur." And so she said, "Okay." And she said, "Would you like me to muzzle my dog?" I said, "Sure." So this is obviously a recheck. This is a client who we know we've taught to muzzle train. She put the muzzle on, no sedation. She hugged her dog. She petted her dog. She talked and scratched and talked and scratched. And within maybe a minute and a half, I was able to get two different readings, full 15-second readings. And her dog didn't have a murmur. I had my EKG. So it's just a different way of approaching the animal. But I will say, to give vets credit, there's a lot of vets in my area who are very, quote unquote, fear-free, who are thinking low stress. Yeah.
Yeah, that's so fantastic. I recently swapped to a different vet for that reason, because she was very amenable to me coming into the room. The other vet always wanted to immediately take my animals in the back, which if it's not something that is necessary, that, the equipment is located there, I prefer to be in the room. I prefer to help with the handling. I do a lot of cooperative care, as you know, and many times it's the restraint that can even be scarier than the actual procedure that the vet needs to perform. Recently, my newest adopted pup is undergoing heartworm treatment. And so we had practiced some touching in the back where she would need to inject. And we brought a licky mat with cream cheese. And she said, "Oh, she didn't even flinch." And she was busy the whole time. And that's not to say that food is the unique answer. A lot of times, like you say, there's a training component and desensitizing the animal to different parts of the exam or the environment. But absolutely, it makes such a difference when you can communicate and move forward in the least stressful way possible. How do you believe working with a trainer on cooperative care can help to make vet appointments less stressful and safer to everyone? I alluded a little bit to some of that, but in your experience, what have you seen?
Yeah. So, I think that, first of all, the way that we, cooperative care can mean lots of things, right? And the way that I think of it for me is I think of the whole training series. It's really not training. It's the difference between training and behavior modification for pet parents, right? Because there's training, and training can be used lots of ways, right? I train myself to meditate. I train for marathons. Training can be lots of things, okay? So it's just really learning. But behavior modification, we try to use that term when we're talking about changing the the valence of the emotional state, okay, positive or negative, or when we're trying to actually change cognitively how the animal perceives the situation. All right, so we use behavior modification a lot for that. Cooperative care falls under that category for me in my mind, and that is teaching an animal to participate voluntarily in their own care. Now, there's also, other people might say, well, cooperative care is also just teaching a pet to station. Well, teaching a pet to station will assist in medical care. It's not the same as teaching them to participate in, right? So there's all these different levels, right? But where does a trainer fit? A trainer fits in that they teach the stuff, because most veterinarians don't know how to teach the stuff, and most veterinarians don't have time to teach the stuff, right? And so, a mile wide and an inch deep, you have to know where to refer. And so I also know where to refer. I refer to, and you and I have shared a patient where you did the cooperative care, and I had an on the ground trainer here in South Florida work with them on other things. And I think this is something people can't wrap their head around, because a trainer should be able to do everything, right? Like an old timey vet that could do surgery on your cow and give your dog vaccines. That's not how we think anymore, right? So trainers are good at certain things too. They get certifications at certain things too. So not everybody can do cooperative care. So you look for someone who knows how to do it really, really well. And then of course everything goes faster because you're working with somebody who can do it well.
When I teach Karen Pryor Academy Dog Trainer Professional Program, the Dog Trainer Professional Program. And one of the things we do at the end, the last workshop, is talk about what's next and recognize that everybody doesn't have to have expertise, like you say, in every area, that you want to make sure that you're networking with people that you refer or consult, when it might be a spot where you said, like you said, I'm an inch deep versus a mile deep in terms of my knowledge and experience. Along those lines, what criteria do you use when referring pet parents to trainers?
Well, so we first vet all of the trainers we refer to. I don't have any trainers that work for me. I refer out to my pet professional kind of network, right? So here's the questions. Number one, do you recommend foods, medications, or supplements directly to pet parents? If the answer is yes, I will not work with that trainer. Sometimes the answer is yes, and they say, but I won't do that with your patients. And I say, okay. Number two, will you charge our clients more than you charge other clients? I don't know why anyone would do this, but this came up. So I always ask that question. We're looking for a trainer. I don't ask how much people charge. It's not my business. But I just want to know that my clients are not going to be charged more because they work with us. If anything, trainers get a plan from us. They get all of our discharges. I mean, there's information that goes back and forth. Number three, when would you be likely to use a shock, pinch, choke collar, slip leads, loud noises, tossing things at animals, or any punishment-based tools? And that's worded that way. I'm sure you picked up on it. I don't know if pet parents did. When would you? Not will you. Because if you say will you, they say no. But if you say, when would you? They say, well, I don't ever use those except when. And I'm like, no, thank you. There can't be an except when, right? Just because we don't know what to do, that doesn't mean we get to hurt animals. Number four, are you willing to send us a report? We want to know what's happening with our patients. And I just like an email. Hey, I saw them. This is the stuff. Because I want to make sure that, number one, I'm reiterating that to my client. Well, Terrie, I don't want to hear from the client, Terrie told me to do this, because inevitably the telephone game ends up in a mess. Terrie told you to only give your cat tuna for all its food? That sounds weird. Are you sure? I want to know what Terrie really said. Use tuna as your exclusive treat or something like that, right? So then I can say, yes, Terrie said that because here's all the reasons why. And then you can do the same for me and say, Lisa said that because X, Y, Z. Number five, what would you like from us? Because this is not a dictatorship. This is a partnership. What do you want me to do? And most people say, I want a report. I want a plan, which are the same things I want, right? And then also I ask them, what do you think an ongoing partnership looks like, right? I ask them, what is in your wheelhouse? Because I want to know, maybe you're not comfortable with aggression, and I don't want to send you aggression cases, right? I ask them, do you feel comfortable working via video? Because this is important for an animal who is petrified, or for a cat. So any cat, having someone in the house is a hot mess. Because what I tell my clients is that the dog training professional will come to your house. Your cat is probably going to hide, and you will pay her. She's come to your house. You're going to pay her. And you can't be mad at her if nothing happens. But if she's on the computer and you have your earbuds in, your cat doesn't even know, and you get a lot of work done. Same for highly aggressive, fearful dogs. It's going to take a couple sessions for the trainer to even get to know, for the dog rather, to even get used to the trainer. And in that time, you are paying. Okay. And it's fair for you to pay because that person came out and did something. So it may be better for your dog to have the trainer come in through the computer, just a thought. And then I ask, what certifications do you have? Certifications are not the end all, but they're really, really important to me because it shows that the dog training professional did something they didn't have to do to further their knowledge. Because pet parents generally don't care about certifications. So it's probably not going to help you make money. Okay. And so you can set up a business and not have them. But to do a certification, because there's no legislation that licensed dog training professionals at all, to do a certification means you want to know more. You want to have a community. And that's the people that I want to practice with. And finally, I asked the last 2 seminars they went to. If you can't spit those out, we have a problem, because that means to me that you think that you know it all. And that is not the way that it works. I don't know it all. I can tell you the last 2 seminars I went to were both gastrointestinal seminars. One was a webinar and one was at VMX. Chronic diarrhea. I went to a cancer seminar because my dog has cancer. I went to a transitional cell carcinoma seminar. The dog trainer should be able to spit those out. And the ones that do, I know, are out there trying to learn. And that is the kind of person I want handling my patient.
At a recent seminar, Clicker Expo, like I said, a couple weeks ago, I also presented, and I had a veterinarian who specializes in behavior with me because we were talking about that collaborative relationship and how important it is. And as you noted, I've recently done another webinar on how to, or another YouTube video on how to find a trainer, how to become a trainer. I think I've done both of those recently, but people, like you said, don't realize that anybody can just put up a TikTok page and call themselves a trainer without having the experience, knowledge, background, and certifications. And a lot of the certifications, the valid ones, also require you to have continuing education, which is important, like you said, because then you're still learning, you're still staying on top of the latest information versus saying, I know it all. Anything else that we've been chatting about that you think would be helpful for folks to know about veterinary behaviorists or those who specialize in behavior? Because again, I think I'm glad to hear from your side that it's definitely more something that folks are aware of, that vets are knowledgeable about, but I think still there's a piece in the general public, and this is why we're chatting today, that we can help educate a bit more about the subject.
Yeah, I guess what I want to say is kind of a general framing of the behavior of pets. Don't listen to your neighbors or your family that tells you you're crazy for caring about this particular behavior. If it's important to you, it's important. I have sat where you are sitting many times because, my dog needed an intramuscular injection of iron because he has anemia, has iron deficiency anemia as part of his cancer business we're dealing with. And I premedicated him for gabapentin. I gave the injection in my home while he was eating food out of a food toy, and I still premedicated him. Many people would say, I'm over the top. I don't care. But many would say that, right? But stand by your guns. If you think that the welfare and the quality of life of your pet is affected, that's only between you and your pet. Get help. That's number one. Number two, veterinary behaviors are not just drug pushers. I create not necessarily for Terrie, because Terrie's at a very high level. When we communicate, I usually will say, this is my suggested or recommended plan. And I trust that Terrie will do what is most humane and what is effective, right? But for a lot of my trainers, I write out a plan. I understand learning theory. I understand behavior modification. I can write an entire plan. And for some of my clients, I am the dog training professional. For some Some clients, that's what they want, right? So we're not just drug pushers. Is that part of what we do? Heck yeah. And half of your neighborhood's on psychiatric drugs, by the way, and they're doing fine, right? It's not the Walking Dead in your neighborhood. So, yes, we do use drugs, but that's not all we do. And number three, there's always something that can be done. That is not the same question of should we do something, okay? Because sometimes it's not humane to do something when we're talking about medical care, psychiatric care, but there's always something. So when you think you've done it all, I 100% promise you, you have not. There's always the end question of, is it right for the animal for you to do something else? Sometimes it's not right for the animal. Okay. That's not the question that we're talking about now. We're talking about whether or not you've done it all and you haven't. And sometimes it means challenging your vet. Is there more? Sometimes it means I've had a client come to my office and say, this is the last time I'm coming here. And I said, all right, let's talk about that. Let's talk about why you feel that way. And we had an honest conversation. She's like, my dog's not better. I said, okay, let's go back to the beginning. Every recommendation I've made, we're going to go through it. And if it didn't work, I'm checking it off. If it did work, I'm putting it over here. We're going to figure it out. She hadn't done most of what I asked. And we came to the middle of, but really what I needed to know was she couldn't do those things. It's easy to judge somebody, but she finally, because it was a little anger, so we were able to get through it, and she was able to say, I can't do those things. So then I was able to say, I hear you, because she's saying I've done it all. And I'm saying you haven't. But really, we had to get in the messy middle, which was, I can't. I physically can't. I emotionally can't. So then we were able to reframe it. We're talking about just using medicine for your dog. That's what we're talking about. That's okay. Here's the risk, consequences, et cetera. So those are my messages. There's always a way. We're not just drug pushers. And if you think it's important, it's important.
I think it's so important, the note about validating, because like you say, people can be surrounded by their community in that particular moment that say things like, oh, it's just a dog, or they'll just get over it, or you're doing what for your cat? So that's incredibly important to hear that message from you, a professional in the field. And what I always say to folks about meds is, because oftentimes people are reticent, they think it's a last resort. They think it's, like you say, just drugging the animal for the sake of drugging. And I say, your veterinarian is seeking to find the best option, probably the least amount that's needed to give your animal the best quality of life. That's the end goal here, best quality of life for everybody, and whatever is needed in, of course, not an overage amount, but the least that is necessary to get to that point. In terms of, is there something else? I always say, well, it would be nice, when's the best time to plant a tree? 10 years ago, but if we didn't do it then, we can certainly plant it today and move forward from there. And again, like I just said, it comes back to quality of life. We're trying to provide the best scenario for you and your animal. I had some situation recently where I was talking with other trainers about the same thing you just mentioned. Sometimes people can't follow a plan, so then it's our job to get back in there and say, okay, what can you do? What will work in your household, and make it work for them and for their pet again, so we can have that quality of life. So thank you for all you do. It's so great. I love my work with veterinarians who specialize in behavior, because like we've said today, it makes such a difference in the overall picture of the well-being for the animal, and then that happy home. So thank you. I appreciate your time, and thank you for chatting about this subject today.
Thank you for having me on, and we'll both keep putting our capes on and crusading every day for the welfare of our companion animals. That's what we do, you and I, every day. And I'm appreciative of you putting good information out there for pet parents.